Your joints are supposed to move smoothly, quietly, and effortlessly. But what if they're silently breaking down right under your nose? What if every bend, step, or stretch is slowly becoming more painful, stiff, and fragile? In this video, we're exposing the 3 alarming signs that your joints are drying out, a hidden problem that millions face without even realizing it. You'll notice subtle cracks, unexpected stiffness in the mornings, or a strange grinding feeling when you move, and most people brush it off as just aging. But these are urgent warning signals that your cartilage is wearing away, your joints are losing lubrication, and your mobility is at serious risk. Understanding these signs now could save you from years of pain, limited movement, and chronic joint disease. Watch carefully, because your body might already be trying to tell you something critical, and ignoring it could cost you more than you think. 1. Pain and stiffness that gets worse over time. Your joints are supposed to move effortlessly, like perfectly lubricated hinges. But what if the oil inside is slowly vanishing, leaving bones grinding against each other? Pain and stiffness that creeps in silently and worsens over time is one of the first and most insidious signs that your joints are drying, and most people ignore it until the damage becomes severe. It starts subtly, perhaps in the mornings or after long periods of inactivity. A knee feels tight, a shoulder resists rotation, a finger joint hesitates when bending. You might brush it off as fatigue or aging, but this is your body sounding a silent alarm. The underlying cause is often the gradual depletion of synovial fluid, the critical lubricant that cushions and nourishes cartilage, combined with degeneration of cartilage itself. Research shows that by the time noticeable stiffness occurs, cartilage may already have lost significant structural integrity. Studies in rheumatology journals indicate that early cartilage thinning is detectable in imaging years before patients report severe symptoms, making these initial feelings of stiffness a crucial early warning. As the joint continues to dry, the pain evolves from intermittent annoyance to persistent discomfort. This is not ordinary soreness. It is a signal that the protective buffer between bones is eroding, forcing them into abnormal contact during movement. Biomechanical studies reveal that even a 10% loss of synovial fluid viscosity increases friction in joints dramatically, accelerating cartilage wear and promoting micro-damage. This friction triggers an inflammatory cascade, releasing cytokines that not only worsen local pain, but also contribute to systemic inflammation. What makes this process particularly alarming is its invisibility to the naked eye at first. Unlike a sprain or fracture, there is no immediate swelling or bruising. The joint appears normal while silently deteriorating. Over time, though, pain intensifies after activity, and stiffness becomes more pronounced in the mornings or after sitting. Clinical data shows that morning stiffness lasting longer than 30 minutes is strongly correlated with early osteoarthritis and other degenerative joint conditions. The sensation is often described as a deep ache, sometimes accompanied by a grating or crunching feeling known as crepitus. This is your cartilage sending a warning, and it should not be ignored. Researchers studying joint mechanics have found that audible crepitus is often one of the earliest indicators of reduced cartilage thickness and synovial fluid deterioration. These subtle auditory cues are more than annoying. They reflect real biomechanical stress that, if unaddressed, sets the stage for accelerated joint breakdown. People frequently report trying to work through the pain, but this can exacerbate the problem. Repetitive stress on already compromised joints increases microtears in cartilage, enhances inflammation, and perpetuates the cycle of drying and degeneration. Pain intensity often varies depending on activity, but it always increases over time if the underlying cause is left untreated. Even light movements such as climbing stairs, lifting groceries, or opening jars can become disproportionately painful. This disproportionate response is a hallmark of degenerative joint disease and differs fundamentally from normal muscle soreness, which diminishes with recovery and does not worsen progressively. Longitudinal studies indicate that joints experiencing persistent pain and stiffness without injury are far more likely to develop irreversible cartilage loss and require surgical intervention within 5 to 10 years. The most dangerous aspect of this progression is that it quietly undermines your mobility. Early limitations in range of motion may feel minor, but they are precursors to altered biomechanics. When one joint starts moving improperly, adjacent joints are forced to compensate, spreading wear and tear throughout the body and increasing the risk of chronic pain syndromes. Inflammatory markers and biochemical signals further confirm the silent destruction. Elevated levels of cytokines like interleukin 1 beta and tumor necrosis factor alpha have been observed in patients with early joint stiffness, signaling that the body is responding to cartilage stress even before structural damage is apparent on standard X-rays. Research also shows that synovial fluid composition changes as joints dry, with a decrease in hyaluronic acid concentration and viscosity, reducing its shock-absorbing capability. This biochemical deterioration magnifies mechanical stress, creating a vicious cycle of inflammation, pain, and further degeneration. The combination of mechanical and biochemical stress explains why stiffness and pain worsen progressively and why these early symptoms cannot be dismissed as minor annoyances. Age, lifestyle, and systemic health conditions can accelerate this drying process. Sedentary behavior reduces nutrient circulation in cartilage. Poor nutrition deprives joints of necessary building blocks like collagen and glycosaminoglycans, and chronic inflammation from obesity or autoimmune conditions intensifies cartilage breakdown. Even in physically active individuals, repetitive strain and inadequate recovery can hasten joint dehydration and damage. Clinical research emphasizes that early identification of stiffness patterns allows interventions that can slow or even reverse some damage. But once joints are severely compromised, options become limited and often invasive. The psychological and functional impact of progressive joint pain should not be underestimated. People often start avoiding activities that trigger discomfort, which leads to muscle weakening around the joint, reducing support and stability, and further exacerbating wear. This creates a dangerous feedback loop where the joints dry and deteriorate faster because surrounding muscles cannot compensate for lost lubrication and cushioning. Long-term studies in orthopedics show that early physical therapy, targeted exercise, and joint-specific mobility routines significantly preserve function and delay the need for surgical interventions. Urgency is crucial because this is a process you cannot see developing. Pain and stiffness that intensifies over months or years is not just inconvenient. It is a red flag that your joints are literally drying out, losing their protective fluid, and silently eroding under your weight and activity. Early intervention, including optimized nutrition, hydration, anti-inflammatory strategies, targeted mobility exercises, and sometimes medical treatments like viscosupplementation, can restore some cushioning, reduce inflammation, and improve long-term joint survival. Ignoring it guarantees progression, while action now offers a real chance to halt deterioration, maintain mobility, and preserve quality of life. Pain and stiffness that get worse over time are not just symptoms. They are your body screaming for help, and responding early may be the difference between living actively and watching your mobility slip away. 2. Reduced range of motion and loss of flexibility. Imagine waking up one day and realizing that simple movements you once took for granted, reaching overhead, twisting to grab something, or bending down to tie your shoes, feel restricted, awkward, almost like your joints are betraying you. Reduced range of motion and loss of flexibility is one of the clearest, yet most ignored signs that your joints are drying. And it's not just about stiffness. It's a signal that the lubrication and structural integrity inside your joints are collapsing. What most people don't realize is that joints are engineered to glide smoothly thanks to cartilage, synovial fluid, and a network of connective tissues working in harmony. When that harmony begins to fail, even subtle movements become challenging, and this is where danger silently creeps in. Studies in orthopedics have shown that joint range of motion starts decreasing years before severe pain is noticeable, which means by the time you notice a limitation, structural damage is already underway. This loss of flexibility is insidious. It often begins in smaller, frequently used joints like fingers, wrists, or ankles, where you might notice difficulty fully extending or flexing, or a persistent tightness that doesn't improve with stretching. Over time, it spreads to larger joints such as knees, hips, and shoulders. Mechanically, what is happening is a combination of thinning cartilage, reduced synovial fluid viscosity, and tightening of surrounding ligaments and tendons. Research shows that a decrease in synovial fluid not only reduces cushioning, but also lowers the delivery of nutrients and oxygen to cartilage, accelerating wear and reducing elasticity. The connective tissue begins to stiffen, limiting the joint's ability to move through its natural arc, and this limitation creates abnormal movement patterns, which in turn puts extra stress on neighboring muscles and joints. The clinical implications are serious. Reduced range of motion is not just a mobility issue. It is an early indicator of degenerative processes like osteoarthritis or rheumatoid arthritis, both of which involve progressive cartilage degradation and inflammation. One study in the Journal of Rheumatology found that patients who exhibited a 10 to 15% reduction in joint mobility in the first year of symptom onset were significantly more likely to develop moderate to severe joint degeneration within 5 years. This shows that the earliest signs of restricted movement are predictive, not incidental. It's a window of opportunity that many people overlook, mistaking gradual limitation for aging or minor fatigue, while their joints are quietly deteriorating. The process of losing flexibility also triggers compensatory behaviors. When a joint cannot move freely, the surrounding muscles and joints overcompensate, which leads to imbalances, increased wear on neighboring tissues, and heightened risk of injury. For example, restricted hip rotation can affect spinal alignment and knee function, creating a cascade of biomechanical stress. Physiological studies reveal that this kind of compensation amplifies microtrauma in cartilage and connective tissue, accelerating the drying process. The earlier these movement patterns are identified, the more effective interventions like targeted physical therapy, mobility exercises, and controlled stretching can be. However, waiting until pain or visible deformity appears often reduces the efficacy of these interventions. The quality of motion is as critical as the quantity. Clinically, a joint may appear capable of movement, but subtle loss of smoothness, hesitation in transition, or a grinding sensation can indicate underlying cartilage and synovial fluid deterioration. Imaging studies have confirmed that, even before X-rays reveal joint space narrowing, MRI scans can detect cartilage thinning and synovial fluid reduction that correlate with reduced mobility. This means that the joint is drying internally long before external signs become evident. The creeping limitation is often accompanied by stiffness that worsens after periods of inactivity or in the morning, which further reduces functional range and discourages movement. This is particularly dangerous because inactivity exacerbates joint degradation, reduces muscular support, and further limits flexibility, a vicious cycle. There is also a biochemical component to this decline. Reduced movement and drying joints lead to localized inflammation, releasing cytokines such as interleukin-6 and tumor necrosis factor alpha, which further break down cartilage and weaken tendons and ligaments. Synovial fluid, which normally provides lubrication and shock absorption, becomes less viscous and less effective at reducing friction. Research in rheumatology indicates that by the time patients notice reduced flexibility, synovial fluid viscosity can be decreased by up to 30%, significantly increasing mechanical stress within the joint. This is why loss of motion is more than an inconvenience. It is a biological alarm that structural integrity is at risk. The psychological and functional impact cannot be overstated. Reduced flexibility affects posture, gait, and confidence in movement. People begin avoiding activities that challenge the limited joint, which leads to muscle atrophy, further destabilizing the joint and perpetuating damage. Studies in physical medicine have shown that early intervention with mobility-focused exercises and neuromuscular training can preserve joint range and slow degeneration, highlighting the importance of detecting and addressing flexibility loss before it becomes severe. Conversely, delaying action allows irreversible changes in cartilage, tendons, and ligaments, increasing the risk of joint replacement in the long term. Urgency is critical. Every day that restricted movement goes unaddressed, microscopic damage accumulates, lubrication diminishes, and inflammation intensifies. What starts as a minor inconvenience can transform into chronic pain, functional limitations, and permanent joint deformity. Early recognition, paying attention to subtle reductions in how far your joints bend, rotate, or extend, is essential. Regular mobility exercises, maintaining optimal hydration, proper nutrition rich in collagen precursors, anti-inflammatory nutrients, and controlled low-impact physical activity are scientifically proven to support synovial fluid health and joint flexibility. When combined with early medical evaluation, these measures can halt or significantly slow the drying process, preserving mobility and quality of life. Reduced range of motion and loss of flexibility is not just a symptom. It is a warning system, a biologically driven alarm that your joints are drying and losing the ability to function. Ignoring it invites progressive degeneration, while responding promptly provides hope, preserves function, and keeps your body moving with strength and freedom. This is the moment to listen, act, and intervene before your joints lose more than motion. They lose resilience, stability, and independence. 3. Grinding, crunching, or clicking sensations. There is a sound your body makes that few people pay attention to, yet it carries a warning you cannot afford to ignore. Grinding, crunching, or clicking sensations in your joints are not harmless quirks. They are the unmistakable signals that your joints are drying and deteriorating from the inside out. What makes this phenomenon terrifying is its deceptive subtlety. At first, it may appear during ordinary movements. A knee bends while walking, a shoulder rotates overhead, a finger curls, and you hear a faint click or feel a slight roughness. Most people dismiss it as normal aging or just the way joints move, but the truth is far more alarming. These noises are caused by irregular surfaces in the joint gliding over one another, often due to cartilage thinning, loss of synovial fluid, or microfractures in the bone underneath. Research in musculoskeletal medicine has repeatedly shown that audible joint sounds correlate strongly with cartilage degradation and early osteoarthritis, making them early warning signs of serious structural compromise. The mechanism behind these sensations is complex. Healthy joints are coated with smooth cartilage and lubricated by synovial fluid that allows bones to glide without friction. As joints dry, cartilage loses elasticity and wears down. Synovial fluid becomes less viscous, and tiny pockets of gas can form within the fluid. When the joint moves, these gas pockets collapse or bones rub against roughened cartilage, producing audible and tactile sensations of grinding, crunching, or clicking. Studies using high-resolution MRI and arthroscopy have confirmed that these early mechanical changes often precede noticeable pain or swelling, which means the warning appears long before the body manifests more obvious symptoms. This is why the sound is so critical. It is an early indicator, a red flag, of progressive deterioration. The progression is insidious. Initially, the sensations are sporadic and may only occur with certain movements, such as squatting, bending, or gripping. Over months and years, the noises become more frequent, louder, and sometimes accompanied by mild discomfort. The increase in frequency is not just annoying. It reflects accelerating joint damage. Research in rheumatology has found that patients with persistent crepitus over a 2-year period were significantly more likely to show measurable cartilage thinning on MRI scans, even when conventional X-rays appeared normal. This highlights the silent, destructive trajectory that grinding sensations reveal. The joint is losing its protective lubrication and structural integrity without triggering acute pain yet. Audible joint changes are often paired with biomechanical consequences. As cartilage thins and lubrication declines, the joint's natural shock absorption diminishes, forcing surrounding muscles, ligaments, and tendons to compensate. This increases the risk of strain, microtears, and misalignment. The repetitive friction from grinding accelerates cartilage breakdown, creating a vicious cycle. Clinical research demonstrates that early intervention focused on restoring mobility, reducing inflammation, and supporting cartilage health can slow or partially reverse these changes. Ignoring the warning sounds, however, allows damage to accumulate silently, eventually leading to chronic pain, reduced range of motion, and in severe cases, the need for surgical intervention. There is also a biochemical cascade happening beneath the audible symptoms. Mechanical stress on cartilage stimulates the release of inflammatory cytokines such as interleukin-1 beta and tumor necrosis factor alpha, which degrade cartilage matrix and reduce chondrocyte function. Simultaneously, synovial fluid loses its ability to replenish these tissues efficiently. Studies indicate that joints exhibiting early crepitus often show measurable reductions in hyaluronic acid levels, directly decreasing lubrication and shock absorption. This explains why joints begin to feel stiff, less mobile, and noisier. The tissues are literally drying out and losing their resilience. Patients often describe a rough sensation, a mild catching, or audible clicks that make movement feel irregular. These sensations are not harmless quirks. They signal structural changes that compromise the joint's ability to withstand normal loads. Orthopedic studies show that patients who experience these grinding sounds, along with early stiffness, are at much higher risk of accelerated cartilage loss over 5 years. What's terrifying is that this process can remain invisible externally. There may be no swelling, redness, or warmth initially, yet the internal architecture of the joint is deteriorating. The subtlety of these changes is what makes early detection so critical. Environmental and lifestyle factors amplify the damage. Sedentary behavior, repetitive joint stress, poor nutrition, dehydration, smoking, and chronic inflammation all worsen the progression of cartilage wear and joint drying. Conversely, interventions like low-impact exercise, targeted strength training around the joint, proper hydration, and nutrition rich in collagen and anti-inflammatory compounds can significantly improve joint function and reduce the severity of grinding and clicking. Pulmonary and musculoskeletal research suggests that restoring movement, reducing joint stress, and supporting synovial health can prevent further structural loss, even if some early damage is already present. The urgency to recognize and act upon these signs cannot be overstated. Grinding, crunching, and clicking are not merely inconveniences. They are early alarms that your joints are losing their lubrication, cartilage is thinning, and structural integrity is under threat. Ignoring them leads to cumulative damage, progressive stiffness, and eventually severe functional impairment. Early attention can preserve mobility, maintain strength, and prevent a cascade of compensatory injuries in surrounding muscles and joints. This is your body signaling an internal crisis before pain and swelling become dominant, offering a window of opportunity to intervene with lifestyle strategies, physical therapy, and medical evaluation to halt or slow joint deterioration. Understanding and respecting these sensations gives you a powerful advantage. You can monitor patterns, notice when they worsen with specific activities, and take steps to reduce inflammation, support cartilage, and improve lubrication before irreversible damage sets in. Studies repeatedly confirm that joints retain remarkable resilience when early interventions are applied, and patients who act promptly maintain both mobility and quality of life, far longer than those who dismiss the warning signs. These grinding sounds, subtle as they may seem, are not random. They are a biological cry for help, a chance to act before your joints lose their strength, flexibility, and function entirely. Don't ignore your joints. What feels small today can become a huge problem tomorrow. If you noticed any of these signs, take action now, protect your mobility, and share this video with someone who needs to know. Hit like, subscribe, and turn on notifications so you never miss vital health alerts that could save your life.